There are a lot of general practitioners across all of the different health disciplines that feel like they need to be able to serve everybody, do everything. Even in family practice, you can start to niche down a little bit, right? So there are a lot of possibilities for you to go, what do I really enjoy doing? And what do I really not enjoy doing? And how do I do more of what I love and less of what I don't? And like, it's I use this example often, but when I was still working clinically, like I kind of hated diabetes. I never enjoyed it in school. I'm so sick of going to continuing ed events about diabetes. Like I have no interest at all, which is too bad because when you're a pharmacist, there's obviously a lot of money in diabetes. But you give me like a methadone patient or a breast pump patient or a prenatal patient or mental health patient, I'm so excited and I love spending my time with them. But you give me a new insulin start and I'm like, this is the worst. I hate this. So it's really just, even in clinical practice, trying to figure out how can you organize your time? How can you work on a team with people with different interests and different skills? So you're spending most of your time doing work you're engaged in, and that's going to decrease your risk of burnout in the long run.
Out of all the people you interact with, I mean, is that one of the most common things you see is people spending their time doing things they don't personally find rewarding and fulfilling?
Yeah, and they have no idea how to get out of it.
And what
There are
is
very
the
few healthcare providers I work with and that I know personally, even like anecdotally in all of my networks, that like honestly, truly, really love their jobs. And that's sad.
it is. It's
There's
very weird. It's like
the number of
we
times they say like, this is not what I thought I was signing up for
yeah.
is huge.
And then it's strange, right? Because it's like such a highly sought after competitive field, like every kid wants to grow up going into the healthcare,
Yeah.
being a nurse, a pharmacist, a doctor, or
Yeah.
whatever, right? It's just seen as a noble profession, fairly well remunerated, you get
Yeah.
respect publicly. It's got a lot going for it, but then why does that start to break down after you get there? It's the grass
Yeah.
wasn't that green afterwards.
That's right. Well, like a few things. Like one, I think the job is not really what they thought they were getting into. A lot of the time, the compensation is not there. Physicians, I think, are a great example. Like people think family physicians make a huge amount of money because of how much they bill, but they forget that you have to pay rent and you have to pay, your admin and your like. There are all these other costs, and the amount you bill is not the amount you keep, right? And I don't think the public thinks that way necessarily. I also think, yeah, you're right. Like there's some level of prestige that comes with a lot of these positions and kind of ego in society. And then I think what's really hard from for a lot of people is that they feel like, they should feel like they're lucky that they got here and they're privileged to be there. And so they feel a lot of guilt admitting that they don't actually love it. And we've spent way too long in healthcare telling people in healthcare like this is a selfless profession and you know patients first, and like that's true, but at what cost, right? We have to also be taking care of ourselves and our colleagues, and until we do that well, we're never going to fix this healthcare system. I would say like problem solving, communication skills,
Hmm.
um conflict management. Like there are a lot of people that have a hard time saying no, or again, like adding in those boundaries, and whether that's a hospital area. Like I have a coachee that's working double clinical right now because they're down staff. And as a result, a lot of her other portfolio work is getting destroyed. Like she can't keep up. And it's really unfortunate, but it's because the system will always give you more to do. And so we need to be able to either attract people that have the ability to manage their time really well and assert their own boundaries, or we need to teach them those skills in the programs. And we're not really doing those things. So there's a lot of opportunity, I think, to do that better and set people up for success when they leave the program. We're not doing that right now.
How could you test for that, back during the admissions process? Like, is there an MCAT question that would be able to encompass that or something you'd look for?
Yeah. I don't have a good answer to that question. I don't know. But I do think, people can study really hard for the MCATs. A lot of people can get a good grade. Some programs still have interviews, some don't. What we know about interviews is people can also do really well on interviews, and it's not necessarily indicative of how they would actually behave in real life. The
So
best
much
predictor of how
randomness.
people will Yeah, the best predictor of how people will perform is how they've performed in the past. And so, trying to understand what people have done in the past and how they've navigated situations is important, but with the caveat that we can't make people re-traumatize themselves having to share all of their personal stories, during interviews and things like that. So, I don't know. I don't know what the perfect answer is, but I think that it's healthcare can't be about who is the best at memorizing things and getting really great exam scores, because like I got straight A's in school and all of the things I did, but if you handed me one of those exams right now, I'd probably get zero on some of them. It's not just
Oh
because I
yeah.
was great at memorizing things doesn't mean I'm necessarily like a medicinal chemist anymore. So it's not the best way of evaluating. There's a lot of research in teaching and learning that says exams aren't even the best way to evaluate people's performance anymore. And so, yeah, we need to think differently, more critically, looking at some of the complexities instead of the averages, both from a patient perspective, but also from a provider perspective. We
So
need to do
what's even
better.
on the other side of that? What would be the alternative meter stick for measuring performance if not exams?
Experiential probably would be a huge one. Like conversation. There's, that's probably a great question for people in education, but there's a lot of study out there around adult learning and evaluating, even looking at things like exam anxiety. I know brilliant people that have not passed university or graduate level courses because they get such bad exam anxiety, and that's not indicative of how they would practice.
It's unfortunate that that's 4 years plus of like undergrad work all culminates in your grade, which is the primary thing, and then you do like 2 hours of interviews to assess your people
Mhm.
skills, and then that's pretty much it. Like
That's
then
right.
you wind up with a bunch of this type of personality that's overdoing it. Sometimes not the best communicators.
And I'll add to, the grades and the requirements to get into these programs is not a great way to assess who's coming in either. We put, I've said before, we put so much value on the experience people have volunteering in shelters and soup kitchens in their admission processes, but we undervalue the experience of having grown up in a shelter or soup kitchen. The fact that you grew up without the privilege of being around books and a parent who was home to read to you and do all of these things and extracurricular activities and opportunity like that, you're already having a difficult time getting in at all to any of these programs. And at least some of them, like medicine's actually doing a better job than everyone else. They have more attempts at having better diversity in admissions right now, and they have more scholarships and funding and subsidization than other programs. But if you come from a family that's not, if you haven't grown up with some level of privilege, it's almost impossible to get into a school like pharmacy or dentistry.
I'm Dr. Jordan Vollrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.